Good day, ma'am. I am Rachel Mercado Rachel from BSN 1-6. So this is the continuation of the assessment that I made last Friday. Again, this assessment should be completed without the patient's experiencing anxiety or discomfort. The findings should be documented and an appropriate referral should be made as needed to other healthcare professionals for further evaluation. Good day, ma'am. I am Rachel Mercado, a student nurse from Wesleyan University, Philippines, and I will take care of you from 1 p.m. to 7 p.m. For safety purposes, may I hold your hand as I check your ID bond? Okay, ma'am, for verification purposes, can you state your name, age, and birthday?
I am Irene Inserto, 19 years old, September 13, 2003.
Okay, ma'am, so I'm here to assess your nasal, mouth, and neck. So, why we do this? We do this to prevent any anomalies and detect further health issues. So, ma'am, do you have any questions before I start? Thank you. But if you have, kindly ask me throughout the assessment. But in order for me to assess those parts that I have mentioned, can I ask your permission to touch those certain body parts, especially the one I will be assessed?
Yes.
Now, ma'am, I'm going to perform hand hygiene and I will wear safety gloves to prevent microorganisms. Rest assured, ma'am, that this whole assessment will be completed confidentially between me and the physician that I'll be referring to. Okay, ma'am, the first part of your body that I'll be assessing is your nasal. In assessing our client's nasal, we should look for its color, shape, consistency, patency, and tenderness. Can I hold your chin and check your nasal, ma'am? Can I touch it?
Yes.
Do you feel any pressure? How about the pain? Can you inhale? Exhale? Can you inhale? Exhale. Okay, as I assessing, looking my client's nose earlier, the client is still there. The shape is symmetrical and is also free from any swelling. Also, she didn't feel any pain or discomfort as I examined her. The patency in my client's nasal is also normal and she covered her left and right nostrils and she also felt no difficulty in her nose as she exhaled. Now, ma'am, the part of your nose that I am assessing is your internal nares and nasal septum. In assessing the internal nares of our client, we should take note on its color, moisture, and presence of exudates. And on the other hand, in the nasal septum, we should look for its placement and also the presence of discharge. Ma'am, kindly look up as I will check your internal nares and nasal septum. I will palpate your nose and later I will use my pen light otoscope to know if there are any abnormalities that should take note to prevent further problems. Do you feel any pain? So, I was checking your internal nares. It is good condition. No swelling, no inflammation. Your mucosa is a dark pink color, which is normal. It is also in the right amount of moisture. There is no sign of fluid discharge and it is free from exudates. Your nasal septum is in normal state. It is straight, intact, and free of ulcers and perforations. Overall, My client's nose is normal condition. But if our client is showing any signs of abnormalities, we should take them because it can be an indication that our client needs extensive examination. Okay, ma'am. The next thing that I will be examining is your mouth. Let me first inspect your lips. Alright, your lips appear pink and moist. Also, there are no lesions. Now, ma'am, I will check your gums. Kindly allow me to pull your upper lip and lower lip so I can truly check your gums if there are any problems. So I was observing the gums of my clients earlier. It is pink and it's consistently is evident in her gum line. Also, it is moist and there are no lesions. Okay, I will assess your teeth. Kindly open your mouth. As you can, I can check your teeth if it is okay, ma'am. So I was looking for my client's teeth. It is intact and free from any abnormal findings. She has 32 pearly white teeth, has smooth surfaces and edges. Also, the teeth's enamel are in a healthy condition. And we have any caries. Now, ma'am, kindly stick your tongue out, then say ah.
Ah.
Okay. And now kindly lift your tongue out. Alright. You can close now for it a second. So as my client was sticking her tongue out, I observed that her tongue is pink and moist and has a moderate size with papillae. Her tongue is also in the midline and there are no lesions. She can also move her tongue easily. It is an indication that there are no problems in the movement of her uvula. On the other hand, her frenulum doesn't have any problems as well. It is in the right position and there are no signs of inflammations or any infections. Now, ma'am, kindly open your mouth and again I will check your buccal mucosa. I will use tongue depressor and this pen light examine you truly. Okay, ma'am. The buccal mucosa appear pink and lost and with no lesions. Okay, I will use pen light. Okay, your mucosa is appear pink. Okay. It is smooth and no lesions. Now, ma'am, I will be assessing your palates and uvula for the last time. Kindly open your mouth and stick your tongue out as I will depress your tongue to check your uvula and your palate. Now say ah.
Ah.
Okay. I was assessing my client's tongue. She can still speak and breathe normally. Her soft palate is light pink and smooth, other than that it doesn't have any problem. It is also a midline position and there is no lesions abnormality. And my client's voice is the right pitch without problems. There is no hoarseness and it is well modulated. Overall, my client's mouth has normality. Have no abnormality rather. Now, ma'am, I will assess your neck. I will assess your neck po, ma'am. Ma'am, please check your in order to determine that any issues. I will also through palpate it to detect or any lumps or masses. Do you feel any pain now that I am assessing or Now, ma'am, when I was examining your neck earlier, I can say that it looked symmetric. There are no lumps, swellings as well. And it doesn't seem like your neck disproportionate to the size on your body. Also, there are no problems with your lymph nodes as well. But in our patient's neck has no lumps and any problems, we should take note of this because it can be a sign of medical condition and we should refer to a doctor immediately. This is a very reasons why I urge our clients to take full body checkups. But our client's check has no lumps, any problems. Now, ma'am, I will check your range motion of your neck. Kindly put your chin up, ma'am. Then put your chin down on your chest and turn side to side. Then put your ear to right shoulder. Now, do it other side po. Alright, good. So the range of your motion on your neck is normal. You can move it freely without any difficulty at all. Now, the last part of the assessment is to check and to determine the strength of sternocleidomastoid muscle and the trapezius muscle. Now, ma'am, I'm going to have you strike on your shoulder and kindly make my resistance as I check press downwards. Now, kindly flex your neck onto right side. Again, meet my resistance again on your left side. Now again, can you flex your left? Okay, thank you. All right. Yes, again, all right. My client's shoulder is symmetrical. She can resist the force that I applied in his sternocleidomastoid. Rather, sternocleidomastoid and trapezius. Okay, ma'am, thank you for cooperation. You can now freshen up and I will call you ASAP if the position is already available. Thank you, ma'am.